In every breaking news alert, we see the same pictures: collapsed buildings, flooded streets, families searching for food and shelter. But there is a second disaster that no camera can capture: the quiet storm inside the mind. A storm that lingers long after the waters recede and the rubble is cleared. This World Mental Health Day 2025 carries a warning. Survival is not only about breath and heartbeat. It is about memory, meaning, and the fragile chemistry of the human mind. What do we mean by mental health? According to the World Health Organization, mental health is a state of well-being that allows us to cope with life's stresses, realize our abilities, learn, work, and contribute to our communities. It is not simply the absence of illness. It is the foundation of every dream, every relationship, every act of courage. At any given moment, a web of factors, family bonds, community support, economic security, protects or undermines this balance. Most people are resilient, but when poverty, violence, or inequality strike, that web tears. Now imagine that balance shattered overnight. An earthquake in the dead of night. A cyclone that swallows an entire coastline. A war that forces millions to flee. Emergencies do more than destroy homes. They upend the mind's ability to feel safe. Nearly 1 in 5 people exposed to war or disaster will develop depression, anxiety, post-traumatic stress disorder, bipolar disorder, or schizophrenia. That is not a distant statistic. It could be the person standing beside you in a relief line. World Health Organization research reveals that almost all people affected by emergencies experience psychological distress, and roughly 22% develop a diagnosable mental condition. Yet mental health systems are fragile everywhere. A global median of only 13 mental health workers per 100,000 people, dropping to just 2 in low-income countries. When a flood washes away hospitals or a war empties clinics, care collapses entirely. In Pakistan's 2022 floods, less than 1% of relief funding reached mental health services. These are not mere funding gaps, they are lives left untreated. Why does help fail to reach those in need? The barriers are layered. Infrastructure crumbles, roads are cut off, medication supply chains break. Stigma silences survivors who fear being labeled weak or crazy. Even responders face a hidden toll. Constant exposure to trauma, the pressure to save others, and sleepless nights place immense strain on doctors, aid workers, and volunteers. The World Federation for Mental Health calls for urgent protection of these frontline heroes. Yet there is hope and proof that action works. After the 2015 Nepal earthquake, community counseling programs cut untreated depression rates in half within a year. In Sri Lanka, the 2004 tsunami sparked a mental health reform so sweeping that every district now has services where only a third had them before. After Typhoon Haiyan in the Philippines, who trained over 1,300 community workers in psychological first aid, bringing care to every health facility. These successes show that when mental health is treated as an emergency service, recovery is faster and lives are saved. Consider the rescuers themselves. Firefighters digging through rubble, nurses in overcrowded field hospitals, aid workers comforting grieving families. They carry images they cannot erase. Without proper support, many develop depression, anxiety, or burnout. Protecting their mental health is not only compassion, it is essential to sustaining disaster response itself. This year's theme, Access to services, mental health in catastrophes and emergencies is more than a slogan. It is a demand. Governments must include mental health support in every disaster plan, fund training in psychological first aid, and guarantee continuity of medication for chronic conditions. The United Nations and World Health Organization urge nations to invest at least 5% of health budgets in mental health and to integrate care into primary health systems. Because the next crisis is not a question of if, but when. What about us, the viewers, the neighbors, the ordinary citizens? We can learn the signs of trauma and offer basic psychological first aid. We can support organizations that provide counseling where tragedy strikes. We can speak openly about therapy to break the silence. And we can demand that leaders treat mental health as urgently as food, water, and shelter. Disasters will return. Storms will rise. Wars will burn. But if we rescue only the body and neglect the mind, our work is unfinished. The next time you see breaking news of a flood, a conflict, a fire, remember, behind every collapsed building is a fragile human spirit. Survival is not enough. The mind deserves rescue too. On this World Mental Health Day 2025, let this be our promise. No one should face catastrophe alone, not in body, not in mind,